How is everyone doing today? Great. I am so pleased to see all of you here. Richard tells me that this is our 9th meeting. Can you believe it? It's gone by really quick. And unlike many things that happen in the world, this process will come to an end with a positive outcome. And so we are at our second to the last meeting. Our focus today will be reviewing our potential recommendations. We encourage your input. We know that you just got the report a moment ago. That's why this is our second to the last meeting. But, so we encourage your support. You will see in this report, in this draft report, many of your comments and directions and concerns expressed throughout the report. And I want to thank Adria and Richard and Solomon for working through this. And also, I don't know if anyone has met Kate Wilbur. Kate has met from USC as well. So, and Mark Lockham is here today from the supervisor's office. I understand that the supervisor herself will be here for our final meeting. So if you have colleagues that aren't here today that were here at the beginning, they need to be here at the end so that we can have a celebration of the work that we have done. So with that, I want to turn it over to Richard and Adria and Solomon, and they're going to lead you through the balance of the meeting.
Thank you so much, Cindy. Appreciate it. Just want to reiterate also the thanks that we have for all the great work that you've provided to us, all the great collaboration, and all of that. It's been quite an effort by all of us, and I think we definitely should be commended for all the great work that we've done. I'll tell you what a difference a week makes. About a week ago, we were scrambling. We were really concerned that we wouldn't have a decent product for you guys to review today. But my goodness, we've been working, burning that midnight oil, really, working till the 11th hour, really trying to get this all together. We believe that we have a very strong proposal here for the board, and thanks to all of you. You've done such great work in really providing us the input, the feedback to where we are today with this report. So, like Cynthia mentioned, we're going to be going very detailed with the report itself. We know it's close to where we want it to be. It may not be 100%, but today is really critical to really get the input that we need to get it to the 100% that it should be at. So once again, thank you so much. A few housekeeping things. Of course, again, we all are aware that this meeting is subject to the Brown Act. Therefore, it is open to public comment. So at the end of the meeting, we will have a few minutes for the public to comment on any of our issues today that we put forward. You have the agenda in front of you. We are pretty much going by the agenda today. One thing, unfortunately, best laid plans, the meeting will only go to 2:30 in this particular room, okay? If we need additional 30 minutes or so to get this finished, then we'll be moving up to a room upstairs, okay? So we hope to go through this very quickly, so hopefully we'll be able to get this done by 2:30. But if not, we do have that option as well. So I think we'll be fine. We actually have a PowerPoint presentation for you today. Did I miss anything? Anything else that you want to add?
Introductions?
Oh yeah, introductions would be really helpful, I think. I'm Richard Franco. I'm with WDAX Adult Detectives. We're going to go ahead with the presentation. Just a little bit of a background. I know that we all know how we got here, right? It's been some incredible work by all of us, but just wanted to summarize really quickly what, again, has brought us to this point in time. As you know, the board motion was brought forward by Supervisor Hahn, supported also by Supervisor Barger, and that motion was brought to us, and when was that? February 28th, correct. So here we are, is it 8 or 9 months, and again, we've done some great work, and I think the report will show that when we provide it to you today. The task force meetings, this is our 9th meeting, our second to last meeting, as Cynthia had mentioned. We put together a BOLOH website, very complete comprehensive website for everyone to know about and learn about the wandering issue here in LA County. As you recall, we also did surveys to gather and glean information from the different agencies throughout LA County to provide us with some great information as we move forward with this review recommendations. And of course, as you all know, we also brought Dr. Wilbur and Dr. Navarro here as our academic research partner. Very instrumental, obviously, in putting this all together. And really what was, I think for us, really the crucial part, obviously, was getting the feedback from you guys. And when we identified the 4 core issues, that we need to concentrate on to move this project forward, I think that really catapulted us to where we needed to be today. So, those discussions were very critical and impactful to what we are providing in terms of this report. So, what we have, we're going to be doing a little of, I'm sure there'll be a little repetition in our actual presentation today, but repetition is sometimes good because we want to make sure we hammer you guys over the head with this so you're very clear on what our plan is. What we are proposing is that we put together a BOLOH initiative. We have done such great work here in the past 8-9 months, but we know that there's so much more work to be done. Okay, so we feel that we will approach the board and request that they endorse this 3-year initiative, which we will be calling the BOLOH initiative. And this is not simply a planning process for this particular project. We want to make sure that we are planning for sure, we're developing for sure, but we're also implementing. Because we know that time is of the essence when it comes to this wandering issue, and we have to move fast. So this is the BOLOH initiative. Again, we'll talk more specifically about what that entails and what we'll be taking to the board shortly within our presentation. What we're also recommending as part of our work group discussions is that a lead agency be involved, and that's what we're going to be doing. We're going to be designating a lead agency, and we'll be talking about that very shortly. It's going to be a big, what do you call it? Big reveal, right? Also within that lead agency, we'll be asking the board that we create the vision of or a unit to really push and propel this project forward. So we'll be asking for allocations to create this specific unit. So who is this lead agency that we are proposing? Uh-oh. Come on now.
Drum roll.
Drum roll. There it is. I know at our last meeting this is something that we were all discussing and trying to come to a conclusion on. I know there was a lot of different ideas put together, after some more careful consideration, and also the fact that we've already been leading this effort, right? That it really was the right thing to do for REDAX to take on this role as the lead agency for this 3-year implementation plan. So we're very happy about it, and we'll be discussing exactly why we feel that we are the right department to head this. Go back a little bit here. I think let's see here, REDAX. Okay. Well, let's talk about this first before I go into the lead agency. Why we think this initiative is going to work. We feel that the proposal is very comprehensive. We have a lot of things that we're trying to do here, but at the same time, it's very focused. As you will see, as we review this report more closely, we have some specific things that we want to implement ASAP, and that's what's really one of the great benefits of this particular project. It's a centralized process. I think that's what all have been calling for, that there's a lead agency involved to really organize all the efforts that need to be made. So that's definitely one of the great benefits of this. Obviously, we're integrating this. No, sorry, not obviously. But as you guys are aware, there is some other initiatives within the county that our department is actually in charge of. I believe some of you are very familiar with the Purposeful Aging Los Angeles initiative. Well, we feel that this aligns very well with that. And since WDEX is the lead for that particular initiative, we feel that this aligns very well with that. So, also, of course, collaboration. We deal with a lot of different task force and initiatives. We believe that we have that expertise. Flexibility. We know that we've learned very quickly as we've gone through this process that we're learning new things every day. There's things that from day to day, it's making us change our minds on how we want to approach the work that we do. So we have to be able to be flexible and ensure that we aren't closed-minded. We're open to ideas, and we really need to know what it takes to move forward. Okay, so going back to that, yay, WDAX again. And why we feel we are a good fit for this. Again, we are the current task force lead. Again, we are very much experienced with initiatives and task force and things of that nature. We feel that we are very innovative and resourceful, just like many of the other departments here, but we feel we are innovative and resourceful. We have a great expertise in the area of aging populations as well as disabled and dependent adults. So we have that expertise. One arm of our department, Adult Protective Services, is a 24/7 operation. We haven't decided exactly where within WDAX this particular project will be operated under. However, we know that APS is a 24/7 operation, so that fits very well within what we think are going to be the requirements of this particular project. And also from a standpoint of technology, we believe that our IT is one of the strongest ones within the county. So we hope that their expertise in that area will really push us in the areas of developing the databases and the different technologies that we want to implement here. So that's our. I feel like a salesman. Hopefully you guys are buying into this, right? So with that, I think we're. That leads to you guys, yes.
Well, and I was just feeling, since I'm a neutral body here, it might be, we don't have a lot of time. We have about an hour to kind of go through 17 different strategies. And so we'll be doing that shortly here. Is there any comments, though, about the lead agency piece that you would like to kind of have that synergy of, as far as concerns, support, other thoughts about that?
I think you probably need to add the not aging people in there specifically as a bullet, that you're able to absorb the minors, autistic young adults.
So that's definitely in our bailiwick.
It could also be missing adolescents and children.
Right.
And children.
Yes. Yeah, that's true. Yeah. Again, we don't encompass everything. However, we do work with children through our workforce programs, but yes, that particular expertise is definitely not WDAX. However, as we go along with this presentation, we'll kind of demonstrate to you why. This is going to be a group effort. We are coordinating efforts. However, this is not going to be something that we're going to be making unilateral decisions. This is going to be a community effort with different departments being involved. So.
I think that's good, though, to kind of be sure that we're kind of sharing any concerns or thoughts or reticence that we might have, because I think finding one particular, department within the county that can take on something this big, this complex, this comprehensive. As I look around the room, I just always get very excited at the fact that we have all of this expertise from all the different sectors that you represent together, and I think it's going to take that kind of work. So I think it's great where we've been able to launch, the task force and really bring that synergy together. And then I think now it's finding a place where we can keep it going, keep the momentum going, because a lot of the work that you brought forward that needs to happen is not something it's not going to get implemented across our diverse, complex county in a real short time, right? So it's going to take that ongoing work. So what I think, let's see, so we've got the recommendations here. Anything else that we haven't touched here? So I guess the 4 areas. So just kind of thinking about, I'm on page 6 of the report, which I think could help as we try to be kind of swift as we run through some of the strategies. But if you think about this in your mind as recommendations, sort of the big picture, and then under that we've got the strategies of really how are we going to begin to make some change and action. So on page 6 here, you've got sort of the list of the different strategies. You have that?
Slightly different than our page 6.
Oh, which one?
Page 9.
Is that page 9? Oh, page 9. It's sideways, so I was looking the wrong way. Okay. 6, 9, yeah, you know. Okay. So I'm looking at where it starts with enhanced coordination. And I think if we kind of all have that in front of us to get the bigger picture, we'll go through the slides a little bit. But before that, thinking of the bigger picture of recommendations, these are the 4 that we'd like to put forward to the board. So endorsing the initiative that Rich has been telling us about, providing leadership for that. Sorry, I'm going to try to project and look at the same time. Let's see, so really looking at this, also kind of identifying the best terminology to use has been such a fascinating journey for me. But I think we've learned from law enforcement that we're talking a lot about the people that meet this definition of at risk. These incidents are the critical missing incidents. So some of the terminology that we all know now is great, but I think we still want to be sure that we're communicating what we're all about to the public, right? So hopefully read this with an eye of, does this make sense? Both professionally, what you know, and then also to the community. We'd like to authorize WEDAC's Workforce Development, Aging, and the Big C Community Services as the lead county department. We'd like to see this be a 3-year initiative with funding. So I think that's great. We really need that help to really put the emphasis here on a position to have that leadership push this through. So we'll be working on the budget numbers, by the way, to kind of look at that. And then endorsing 17 strategies. So any comments just on the recommendations, and then we'll go through the 17 areas. I'll move through there. Anything that anyone wanted to add? Okay. So we've got the 17 strategies. We really worked to think back. We actually included the notes from the work groups because I think there was some great ideas that got thrown in that maybe you won't see in the 17 strategies specifically. But we have sort of these nuggets of what we've tried to capture, something broad enough that includes, the ability to go in different directions. So of the 17 strategies, I felt like 11 of them, there's been a lot of work going on. We've been actually learning so much and actually getting things like, I want to recognize Lieutenant Gannon, who's here in person. He has been so active on this from behind the scenes, really helping us. For example, the checklist. Thank you, John, for all of your support. So we have and Naomi's here as well as from the sheriff. So it's really been helpful to kind of do that legwork. So things like Project Lifesaver and some of the different things, we've really been able to move the ball and learn quite a bit and get things in great shape to keep educating the public and all of the users. So so that's sort of the thinking then. So we've got about 11 things ready to go, a total of 17. And so I think this has been sort of a roadmap that very simple way of thinking about the work that we've been doing. It helped me along our process thinking about sort of the staging of the work that we do. When we think about this population, I think it was Dr. Wilbur who recognized in our connection, in our meetings, that all of us were really talking a lot about prevention, and that really wasn't in the original motion per se, but of course, we all feel like if we can prevent, and actually I look at you now, there was a lot of great voices that said, you know what, let's think about how the community can wrap its arms around and really help prevent a lot of these issues from ever happening in the first place. So that's really a big piece, and that comes under the protecting piece. Then we've got sort of what we focused on initially was all the technology and how can we locate someone once they go missing. So we've got locating, and then actually some of us here met with some social workers, and we've been talking about, sort of when people are found but they're still unidentified, what can we do? What do we need? So we're sort of thinking about the roadmap here or this model when we think about all the different pieces. So, any questions so far? And I know it's, you've seen this before, right? Okay, so we'll move on. What I'd like to do, if it's okay, and Rich, you let me know, I thought we'd just kind of go through the strategies. You know how sometimes you say just keep your questions for the end? That would be nice, but if there's something important, I think we better catch it while we have the synergy of all of us together. So just keep in mind we're a little tight on time, but we want to make sure that everybody digests all of them. Does that make sense? Okay. So the first, as you look at this page 9, you see that some of the numbers, A1 for example, is in red. If something's in red, we're feeling like there's been quite a bit of work on it, and it's really a priority strategy that's pretty ripe and ready to go. So keep that in mind. We've got our 4 work group areas that we all participated in, and after the work groups, we added our 2 cents to all of them, so we've all spoken into these 4 areas, which have really become the domains for the initiative. So the first domain is enhanced coordination, and we've made a lot of hard work. As you can see, all these are primed and ready to go. They're all red. So the first one is, are we moving in? We're in there. So domain A, enhanced coordination. A1 is interprofessional collaboration and coordination meetings. So now I'm not sure how to handle this. Yes? Do we need to say a little bit more? So this is kind of the idea that we need to keep meeting. This is the idea that there's a lot of continued expertise that needs to be brought, kind of interprofessional work, bringing in understanding of our languages, our different areas of practice, and really doing some of the planning work to keep moving things forward. Yes?
Just a quick question. Is there in here somewhere a list that you are going to be presenting of who that is that would be in this?
Let's see. If you go through the, maybe we need to do it that way, huh?
Yeah.
So the first one has these tables. These might give you a little more information. So on the very next page 10, it does include like lead agency. Yeah, it's probably what we need to look at.
I think the question,
What's
Barbara,
that?
is your question who would be involved maybe?
Yeah, I just
in
want to
this?
make sure because
Oh,
we've
we
had
have
these
to-
conversations here where at one point we were like, where's Metro? Why isn't Metro
Right,
here? I mean, I just want to
right.
make sure that it starts with everybody in the room that we would ideally like to have represented. So
Yeah, so, yeah.
I would think this group would be ideally suited to make that list.
Right.
Since it's been
Yes.
us.
Yes, and I think that would be a great attachment to this particular document. And yeah, I think here is also the idea of putting together that steering committee, right, to move, these processes forward.
Clearly leadership is critical to identify, but I just was wondering if we could go kind of one level.
That's exactly what we need to do is tighten up all these loose ends. So this is perfect, Barbara. So everybody else, feel free to add in.
Andrea, yeah, I didn't notice more discussion around this steering committee. What happened with that? I don't see it. Where is in the recommendations?
That's
Again, that is the idea behind this particular
Yeah.
strategy for sure.
Yeah.
We did not include it here, but that's something that we can also provide more detail if that's what you guys would prefer. But definitely the steering committee is a big part of it. And also later on this particular document, you'll see that we're also still trying to include the forensic center MDT function of it as well, dealing with specific difficult,
Where's the Z
high-risk
here?
cases. So,
be happy.
yes.
But there was a lot of discussion around
Yeah.
that. Had a really nice shape. And I noticed that was dropped. That's the reason I'm asking.
But it doesn't
It's
go
not
away.
tough.
It's
Although,
just-
right, it's there.
So what's happened,
We'll
a
add it
couple of
back on.
these have been sort of like there's more of an umbrella. It kind of crystallizes into one.
Yeah.
So this was one of those.
So if you
where
see,
it's like-
it does mention conduct ongoing meetings, and that's basically what we're talking about when it comes to the steering committee.
But are you suggesting that the language of steering committee goes in here
Yes.
so that
Yes.
it
That
says,
doesn't get lost.
can
Because
definitely do that.
exactly, and it was a very clear role that this group was to have. So there were responsibilities and all that, so I'm surprised that it's not
I think you could add steering committee to A1 and just, that is the number one thing you want to enhance coordination, you have international collaboration via
That
the
sounds
steering
good.
committee.
Yeah, under the description, that sounds good.
And probably under the big title too.
Yeah, the time.
Good. Okay, any more additions for A1? Very helpful. Okay, let's go on to A2. So we've got the, again, we're under enhanced coordination, leveraging the existing programs and resources within key agencies. And so if we look here, mandate key agencies listed, list to be provided by WEDAX to designate liaison offices to work with the lead agency. Is there anything more you want to add to that, or?
If I may add, I think when we were discussing about the lead agency and the complexity of having a county-wide system at this time, we thought it would take time until we have that one database system that would be able to integrate and work with all the agency platforms or communicate very smoothly. And the idea came up, until we have that, why don't we utilize existing resources, programs, or we need to start using that maybe to have these key agencies designate liaison offices or, sections
Some personnel.
person. That's to address the critical issue of lack of coordination. I think that was the basis of, this initiative. We learn it again and again. When somebody is missing, there may be people who may help, but simply because of the lack of coordination, those resources are not being utilized. Agencies are not working together.
So people have
this is
like
the
a
concept.
database that, like I know we talked with fire about different, there's like 31 different databases within different fire departments, right? So knowing those contact people so that we could quickly get to the one we need, right? Things like that would be an example, I would think, right?
So
Mr. Moody.
similar to Barbara's comment on A1, I think you would, in the description, probably can't list them all, but you want to give an example of what you're talking about the, not just the liaison offices, but the specific
Thank you.
technologies that you'd like to put in there, or the existing programs. So this, a couple of the database programs that work are the fire departments, databases and things like that, and a couple of the other existing programs that we did talk about quite a bit, to sort of give an idea of what existing programs.
Yeah.
There's
We've
that
got the
Santa
lead
Clarita.
agency and we've got 2 co-leads, but are you thinking maybe some other agencies listed under there?
Well,
Or
I don't think you're talking
Not
agencies.
the agency, I'm talking about the programs.
Technology. He's talking a list of all the databases.
Yeah, and that's actually going to be addressed later
Yeah.
as part of, I believe it's the B1, or is it one of the strategies that we'll be discussing later, but yeah, definitely.
Well, the sheriff's department has a couple of programs that are already going. We can talk about that type of program, that we're trying to leverage that they're already doing, and we want to combine that maybe with, just a couple of examples. It doesn't have to be an exhaustive list because you wouldn't have room, but a couple of examples of the types of things you're talking about in terms of leveraging
like such as?
the existing programs.
Yeah, I would agree with Kirk, and I talked to Richard initially before the meeting, and he said, this report was perhaps shortened a little bit for brevity, to take out specifics, to which I said, yeah, I like specifics. And I think that's the general theme of, we would like some specifics, and so you guys could put some things back in.
For sure.
Possibly every point as we go forward, but certainly these 2 so far.
For sure.
Thank you.
And if I could just add, I think for this particular, and maybe the title of this is a little bit misleading, because this is really one of our more simplistic strategies, really. I mean, all we're doing is identifying key personnel within key agencies. And it dovetails into the next actual strategy, which is developing and implementing the communication protocol. And I think that's really one of the very crucial pieces here that we need to work on. It's something that I felt that we should have been able to produce as part of our task force. However, we haven't gotten there. However, it's going to be definitely one of the priority responsibilities of the WDAX as being the lead agency for this project. Again, the key part of having these communication protocols, you have to have the personnel who you communicate with. The example is, you have an incident, the call goes out to law enforcement. Where do the communications start? Who is contacting who? We have to have the right people contacted at the right time. So that's why it's very critical that this particular strategy be implemented and developed ASAP, so we can get the ball rolling with this.
I'm sorry,
Richard?
before
I
we
have
move
a
on,
comment, yeah.
for A2, going back,
Uh-huh.
in regards to the co-lead for like DCFS and DPSS, shouldn't that be more of everyone involved? I don't see how it would be co-lead for just those two departments. I should think it should be a task force co-lead.
So the,
I think stakeholders, there are many key agencies that need to be involved. The idea here is only to indicate the lead agency and the co-lead agencies.
what does the co-lead do?
Co-lead would,
I'm sorry, I put you on the spot.
Actually, I had some concerns about this particular one as well. I think for this particular strategy, we have the population that we're dealing with. It's either you're going to be your children or your autistic children, or it's going to be a senior or a dependent adult, right? So, my opinion, the co-leads for this would be Adult Protective Services, Regional Center,
Right.
and DCFS.
It's more-
That should be those should be the co-leads for this.
Because DCFS is not going to include all the people who live at home. That's the vast majority of people we serve.
I think the reason why we left Regional Center off here is because, number one, you guys aren't county, so
Right.
we could not, but that is definitely what we're thinking as far as this process.
So some of it, just coming into what can the county dictate or mandate?
Exactly.
So these are the
Exactly.
things that we're asking them to say, okay, you departments have to do this, Whereas we definitely need regional center at the table, but we can't mandate them, we don't have the jurisdiction to do that. Does that make sense? So I
But
think,
invite, you could say, and invite such and such an agency to
Yeah.
participate.
Collaborate.
collaborators, yeah.
Collaborate's a little harder, you can't make collaborators, but you can invite.
I think intent is important.
So that's, I'm hearing like, I can see people say, well, we know that we'll include, and then others saying, and it's important to show your intent. So I think I'm hearing that. It's important to show.
Yeah, I felt that the first initial summary was very inclusive, very descriptive, and that's what we saw. But today I'm finding that it's extra language is missing, so,
Needs to be more expanded.
So, yeah, I think that's kind of putting the policy lens in, to kind of make it, like you said, a little more brevity. Lauren?
What I noticed on A2 was that you're adding victims of parental abduction and victims of other crimes of foul play. I didn't understand that. Could you please expand? That seems to be a very different population.
You're looking at populations targeted?
If you look at the second one, the second bullet on A2,
Persons in need of
it's
medical
after medical attention, I understood up to that point, and then it got into crimes
Honestly,
that are very
that's
different in their nature. So I was a little bit kind of taken aback because I thought none of the at least the social protective entities may not be involved in crimes of foul play. Police would, law enforcement would, but they have protocols and things that they do around
That was actually supposed to be removed.
Okay.
It was initially in basically all of the actual strategies, but that was something.
So will we just delete it?
Right,
Okay, thank you.
That was A3.
You just made me feel much better.
Yeah.
Is that starting at or? Like or?
The second bullet under population.
Like a
target.
whole-
Victims of
whole-
parental abduction.
Starting at victims. Starting at victims, okay.
That's
Right.
A2 and A3 as well.
Yeah, and it's also in A3.
Thank you.
Thank you, Laura.
It's also on page 5, where you list, so page 5 on the bottom, listening to victims of crimes and foul play. On the bottom, we're talking about target population.
So
it's kind of, that might be reflective of the code.
Oh, yeah, this is
Fine.
the code.
Yeah.
Yeah, this is the law.
That's fine, you keep it there when you talk about the code, but when you talk about individual strategies, we'll just ditch it.
Thank you.
Do people feel that you've dealt with the mandate question? So if it's lead agency and co-lead, and then I put other potential partners, has that resolved so that you can, okay.
So we will be putting potential partners. Great. Okay, so we are
Any final questions for that?
So any final questions or input on A3, coordination and communication protocols? So these are the things that, again, are ready to go. You know, we've been actually working on just refining them today a little bit too, right? Okay. All right, we'll go to A4.
This is really minor,
yes,
but you
Carol.
use the word offices for liaison offices versus officers. I'm just thinking, it sounds like it has to be like a more official department versus sometimes it's just a designated person.
What page are you on?
Well, the first one, yeah,
Okay.
it says
Okay.
liaison offices.
So within the box for A3.
I think the idea there was that, just assigning one person may be an issue if we're talking about a 24/7 type of incident. So we would want to hopefully have, a backup to that particular liaison. So not necessarily a unit, however, or an office, but it would be, multiple people assigned for each department, for each key department.
Their liaison contacts. There might be some rewording.
Just thinking, some people may be confused and say, well, we don't have an office of the liaison.
Right.
Yeah,
We have a point of contact.
We can clarify that. We can add
Just
that.
put liaisons.
Slash officers.
And their liaisons.
Liaison.
Uh-huh.
Yeah. Okay, no problem.
Okay, anything more on A3? Go to A4. This is the BOLOH multidisciplinary team meeting. And we talked a lot about this before, having a team that really could begin to work on a complex case together so that we can quickly get a hold of each other and work on aiding those that are involved. Look good?
Hey, that's a simple one.
And actually, it's funny because, all of us have had input on these things, but I think it was Zita, who's not here today, that she's really been a good advocate for that one, and I just want to honor her. We're kind of speaking up, and I think Rich
Yeah.
also was able to say, we need that. So,
She had a scary incident with her son over the weekend. Everything's okay, but it involved hospitalizations. So she wishes she could be here.
tell her that when someone wishes, yeah. Wishes for him. Okay, so we've got, moving on to A5 then, law enforcement investigational checklist. And so this is the specific checklist that we've been able to bring in the Highway Patrol, the LAPD, and our LA Sheriff's Office. You've all had these mandated checklists, and we've been able to kind of bring those together, add to it from what the task force has been sharing, and come up with a best practice kind of list. I like to use the word best practice. Any input on that? And you guys were working on some tightening up, or just, that's one of our appendices, so that's, will be included.
We had some thoughts about this particular one. There's definitely, there may be room here for broadening that particular strategy, because I know that, again, we've already worked on these particular checklists. Thank you again, Lieutenant Gannon, for that great work you've done. But there might be other tools that law enforcement may be in need of to really help them with the coordination and dealing with these particular issues. So we can leave that open to additional types of specific tasks or responsibilities if you feel that there's any additional things that we can add there.
And I guess what I'm thinking, we have the tool, but I think to help people learn about the tool and to use it and to make some refinements probably along the way. I know there's been input about sort of it's a long checklist and things like that. So we've talked about that and weighed in on some of those things. I think to really get it in the hands of the people that would actually benefit, it's going to take a while, right? I mean, I look at you too, we have our expert people that would be using it, but I think putting anything into practice is going to take a bit.
I agree.
Some training, okay.
Audrey, I would recommend that after, because I understand the lead agency is the sheriff and co-lead is LEADADS. Could we have a third bullet that would be in collaboration with, have LAPD, California, and the other major entities, so that you're recognizing that they will be at the table, they will be invited, they will be considered essential elements, rather than to just leave them as a possibility, but not anything in writing. This would at least say, we will extend a formal invitation for their participation.
My question is the 45 other law enforcement agencies, is that exhaustive, that number?
That's all the municipal PDs as well as the sheriff's highway.
Does it include fire or no?
Not in this specific.
And then does it include CHP?
Yes.
That number does? So then I think in calling out, like Laura's saying, the issue's always, if we call it LA, then they'll do the biggest. Do you run through the gamut of all of them, or do we just call it the one that's not anywhere in our county and call CHP out in addition to everybody? Just because they're over and above, I don't know. We'll talk about that, but something like that should be
To clarify.
clarified.
Yeah, thank you.
Yeah, and we did do, a survey went out to all 46, and so we did get about 10 of those folks were really invested in answering and giving us input in addition to those on the task force. So there has been a percolation of input. Okay, so then we're moving to A6. So this was kind of one of our last pieces. This is the need for a hospital diligence search checklist. And some of us met with a couple of the social work leads, LAC, USC, and Harvard, UCLA. Actually, Mr. Moody, George was there as well, Mr. Flavis. And we were able to kind of look at what they've developed and try to enhance it. It still needs a lot more work. We actually had Jaime Garcia from Southern California Hospital Association as well, and they have a policy about unrepresented patients. So it overlays just slightly, but it's different. So I think there's a lot of work there to be done. And so we did put the last appendix in here as some of that early work that has been done.
I think this is a really good description. This might be a model for the other boxes to expand a little bit. The one paragraph, a little more specifics.
Okay.
And then you might put in invitation to 8.5.
Say that.
For the lead agency, invite has to be included.
So that would be again when we can't mandate, but we could say we
Collaboration with.
Yeah, collaborate, invite, find some terminology, yeah. Because he's been wonderful and really helping us. And that was because of your invitation, so thank you. Okay, so anything more on A6? Does that make sense? We sort of launched that one. Okay, so we're moving to our second domain, which is the technology solutions. And I'm so glad that we're going upstairs.
Yeah.
Next one? Yeah. Okay, so technology has been really interesting. We've learned so much. Barbara, we've been learning how, sort of a layered approach is probably the way to go with a lot of the technology that people are using. And that was sage wisdom that we got early on that we didn't want to hear. But we have come to see the light. Project Lifesaver, however, has a lot of potential in the sense of being able to, we have a way to leverage, thanks to Lieutenant Gannon sort of seeing this, that we could actually help with the search and rescue across the county by getting involved. So, John, do you want to say a couple things about this?
By the sheriff's department being trained, we have to have at least 7 staff trained. We have 2 helicopters eligible North and South County and 6 people on the ground who are able to do searches. All cities in LA County automatically become eligible for Project Lifesaver. Through what we call mutual aid, it's automatically requested. Those systems are already in place, and the sheriff's department can mobilize and scramble and have all those things on the ground, usually within an hour. We're out there able to support large and small PDs. We just join in and become a resource to them. So that will save each city from having to purchase Project Lifesaver. That doesn't preclude Glendale, Laverne, and Monrovia are the only ones in the county right now, I believe, that are certified on their own. They can continue to be a member agency directly with the project, but we will, by default, we cover the rest of the county. So it's cost savings as well.
And anyone who wants to get it then would actually have somebody that could find their loved one if they wanted to sign up
Yes.
and they were in a city that wasn't one of those 3.
Yes.
Now, this would immediately, I think, leverage us to be able to use it across the county.
And Sheriff's Department already pre-stages assets all around the county in strategic locations. We would not have all 6 in East LA, for example. They'd be everywhere from Antelope Valley to Avalon. We spread our resources out and we bring it together as needed.
And I know I was at a meeting with Glendale who really educated us a lot about Project Lifesaver and sort of they have this nice small program, and how it's been very high touch. And so we learned a lot from them. Their helicopters are not working right now, and I thought we we've got to get this going because if they need to search for somebody on it right now, they need your air, yeah.
Through your LA County taxpayers' money, you're already buying our helicopters, so we make it available to all cities.
Yeah. I think this is to me one of the more exciting because I just feel like just with a little bit of collaboration, we realize, wait a minute, we can really be cost effective, get the whole county up with that. Any other questions on that one though, or any concerns or clarification? So the second strategy, so this is where I've learned from the literature that a database is really the critical thing we need. And we've talked about databases, there's different databases, and so this one is a proactive registry kind of system is needed, whether it's something new, and we've heard it like the sheriffs have been thinking about something, My Journey Home, I think. There are some existing kinds of things that are going on right now, and then there's some county-sponsored databases. So we think that there might be opportunities to leverage. And I think Solomon already mentioned to you, kind of thinking about ways to maybe even connect some of the databases. So we need something where people can go ahead of any kind of a problem and register. So we're thinking about, what do we do? Do we need something specific to LA County, or do we leverage existing medical alert, other things? Bruce has told us a lot about his, say it again?
Finding out caregiver control.
Yes. So I think that we need a lot more work on this because the literature does show this is the one critical thing that you really need to think about when finding people. It's having a proactive registry. So we need more time on this one.
Yeah, and just
I think with this point, you need to add specifically in the population targeted the caregivers.
Yes. So under the population targeted, we'll add.
Yeah, and under the description, you said you're going to work on it anyway, but the word proactive registry never appears, so.
Yeah, exactly. Okay. I'll get that added
Can you
in.
explain to me what the role of ISD as co-lead would be exactly?
Because of the nature of the project, it's going to involve the county computer environment, and ISD are the lead always when it comes to the county IT infrastructure. So that is still a suggestion anyways, that we can bring other key agencies to get involved in here. The concept itself is still evolving. We're working with UDAC's IT section on this. This is one of the strategies that will take more time compared to a project Lifesaver, for example. So concept, the idea.
We need some expertise.
Yeah,
IT
I don't know
expertise. Remember
if
that?
ISD would be able to provide that, but if they can, then great. I think a CIO would do something, Chief Information Officer, or even somebody else in CEO almost may be a better contact, I'm not sure.
Okay.
Yeah. And then you mentioned timeline, this one would take a longer, B1 would take less time. Again, I spoke with Richard beforehand, and one of the things that I would love to see, and you guys can all chime in, is on these we have title, description, population target, funding, lead agency. I would love to see a final box saying timeline. Is this a quick off the ground project lifesaver, you buy it, it's ready in a month? Or is this a longer, bigger picture that could take 18 months for developing a new, that would be a really nice bullet point to see down there.
For sure.
Expert over here. Expertise. Okay, so we'll move to B3.
Andrea, I have a thought.
Yes.
I will respond to you.
Yes.
As a manager who has to do these things, you triggered my brain cells.
Perfect.
I may want to have it be a report back to the board with timelines, because it will be really dependent on the level of resource investment up front, whether or not the timelines will be feasible. So I could promise you that I'll get you everything by next week, but if next week you give me nobody to work on it and no money, guess what? My timeline just changed. It's going to be never, or next to never. So
no, I think the assumption would be if the timeline's there, it's because the funding is in place and because all that is there. It can be a broad range. Again, this is more for the general sentiments of understanding what this is talking about. Are we talking about something off the ground? Well, overall, but some of these things could be within the first quarter. And that would be great to know what are these low-hanging fruits versus what are the things that we shouldn't expect anything until 3 years is up before there's any kind of
So
evaluation.
I think if it's
But yeah.
broad, like the way that you just put
Broad
it,
is
like
great.
in quarters, nothing more specific than that, then
Yeah,
I would
not
think that's
from
reasonable.
long term.
Otherwise,
Yeah,
you're pushing people into
Not
corners
January
that-
17th, that's not needed.
Thank
but-
you, that makes sense.
But something with a range of understanding.
Thank you.
And Kurt just said short-term, mid-term, long-term.
Yeah.
But-
I just wanted to add to on those particular strategies that we know will be really contingent upon funding, we can add that.
Correct.
Italicized.
That little asterisk or
Yeah.
italicized, that's easy to make it legible for everyone.
Yeah.
That works. Good, thanks. Okay, so we're moving on to B4.
Did we talk about 3 at all?
Oh, B3. We have to go back.
Just for one quick second to what you were talking about the funding. On the way over here, I was thinking that, I'm not sure, I don't want to start a new thing, so I'll just briefly say it. But if we can somehow put a place for people to make donations and grants, because I have all kinds of stuff that I would donate, and I'd also, beginning of each month, I'd look to see, who can I apply for a grant from? So, if there's a place here, that I can communicate with and say I have this idea for donating tractors, that could happen immediately.
Save that up for the public comment piece, but we definitely want to get that in there. I think you're right, we want
In fact,
to
those are-
leverage anything we can.
There are two things that, after doing the final review that we feel that should be added here, and that is the funding opportunities, for sure, that you mentioned, but also the monitoring and support for legislation. I think it's really critical. So that's going to be a big piece for WEDAX. I'm sure it could fit somewhere within here. If not, we'll create a specific strategy just for that. But I don't know if you want to talk about the Kevin and Monty law right now, but I'm not too sure if you guys are familiar with that. But at the federal level, there's a law that was actually tried to be passed about 4 years ago, and that was funding specifically for wandering devices.
Yep.
I'm not sure if you're aware of that. So it's actually back in the picture now, and that's something that they're going to be voting on. Sorry.
I'm optimistic, I promise.
Right. But it's out there at least, it's out there, and it's hey, if we can get something from the feds, that's great. But obviously, we'll do what we can, internally within the county as well.
It speaks to me that people are thinking and worrying about this, I mean,
Yes.
at a national level.
That's
And-
right.
And
That's
so
right.
it's got enough oomph behind it that it's been resubmitted, so, yeah.
And I think that would be part of WDAX's job, right, is to really kind of make this a social issue. And this has to be, I mean, it is an issue, but we have to make people more aware, obviously.
It's the community outreach
Yeah,
piece.
community outreach piece,
So
right.
important.
Exactly.
I think the use of innovative was added, the language after I had been involved, and I thought, this is really an opportunity to innovate. And I think states could actually use some of our plan, and so we have this, again, a leadership opportunity. So let's go back to B3 real quick. B3 was, this is the personal technology resources, so just knowing that in the appendices we have a list of all the things that we've been collecting from we did a survey, and we have a lot of different technology that we've learned about. We've learned that the idea of layering of different technology is important. So I think this is an ongoing issue, to keep up to date. And I'm pleased in public comment we'll hear about another device. There's just a lot of, this is a fast-moving, dynamic part of the piece, and I think it's exciting. And so we want to be sure there's some place in the county where we're tracking that and we're getting the word out to family caregivers that these are opportunities that they can.
And that's the key, is getting the word out, because we can have these fantastic resources put into place, but unless we educate the public and let them know.
Right. And we may, as a county, want to fund some of them. We may find that there's something that, we can help low-income folks be able to access some of the things there's some wonderful things that are really not accessible, unfortunately, to a lot of people in our county. So all of that, I think we really do need that emphasis of somebody looking at the big picture, collecting the ongoing input. So that. Oh, yes. Question?
Sorry, same comment on the population targeted. So I think just looking through all the B's and C's, I think if you have caregivers, it's probably appropriate.
Okay.
Thank you.
Did they capture that right?
Yes.
Very well. Yeah, thank you, Chris. So B4 is, again, under technology, looking at biometrics, and so the importance of electronic photos. We've learned about facial recognition technology. For example, when Metro has a lot of video of things that are happening, if there were a way at some point to begin to move into enhancing with facial recognition, we could, it would be much more usable. Right now, it takes too much time to access a lot of that. And fingerprinting, when we went to the hospital social workers, there's this policy issue that is a real difficulty. They've talked about these wonderful successes. Once somebody was fingerprinted, they found this family that had been looking for their loved one for over a year. But there is a big challenge around the privacy issue, and so I think there's a policy need here probably. But so I think these are all really crucial pieces to being successful in both locating people and identifying them. And interesting, somebody said Universal Studios actually is using facial recognition. You know about it? So I think there's some leaders in our area, in our county, that we could probably also, this committee could reach out.
Because this gets tricky with minors too, and it would leave them out of that technology.
Interesting. Okay, so there's a lot more there to work with. This one, it's interesting. We have it as a priority, but you're right, it's going to have a timeline. Take it out of you first. Okay, so B5. We wanted to include all the different alert systems. We've learned a lot about the different ones that are out there, and we learned a lot initially from the sheriffs about things like Alert LA County, more of a disaster kind of alert system. There's Nixle, and there's a number of platforms and social media that are being used widely. And so right now, I think it's kind of a mishmashi. Certain areas, I've been getting a lot of Glendale alerts lately, you know, from Nixle, but I have a feeling other cities don't even access some of that. So anyway, I feel like we talked about Silver Alert, and I think, did we put that under there? Does it have its own? I think
That's where it's supposed to be, but it's
okay. Yeah.
It's not listed.
Silver Alert has been something that where you clarified sort of the criteria, and I feel like there's probably still a lot of training about how do we get everything lined up so that Silver Alert could be used. I think there's been challenges. So I just got a bunch of Amber Alerts yesterday, and I thought to myself again, you don't get many Silver Alerts, and I know there's a need sometimes. So there's all this whole area of technology that I think we can enhance and coordinate better too. Any input on that? Okay. So B6, provider databases, mutual aid, search and rescue. This feels like the potpourri column. We have a number of key issues that have come up, such as search and rescue using dogs, the scent issue. So I thought, does it go under technology? But I think it does. We've learned that there are some issues about sort of how to utilize these different areas. Anything you want to add to that? Did that get changed at all? It's got a number of things in there, but these are all potential solutions that need additional coordination. Can we move through that one?
Yeah, I was just going to point out, I mean, the description, how you call out in parentheses certain things. I think that's what we're talking about with other descriptions of just throw parentheses, something, something, etc. We won't hold you to it, but it's really nice to see what you're talking about. Of course. So it's here at B6, but it's not in a lot of the other ones.
Okay. Someone says, I had it there.
Yeah, I'm sure.
Yes,
Control Z.
we're getting on page.
Put it
That's
up on the
good.
cutting room floor.
I'm glad we're having our meeting today. That's good. Okay, so we're going to move into the next domain, which is domain C. Everybody's ready? Okay. So this is education and training. And my hat's off to you. We're doing good. I know we're moving at a clip here, so feel free to take notes and let me know outside of the meeting if you need to. So the first one is first responder education. This would include 911 operators, law enforcement, EMS, fire. Get you all in there. So I was impressed, we learned in our work groups that there's so much going on. There's a lot of mandates already in place for the training, a lot of expert trainers that are doing the work. So this is, I think, to kind of stay in touch with that work, get a sense of what's being done. I think there's some high like numbers of people that still need to be trained, and so there might be some ways to strategize how to get people through training, how to get new people trained quicker, or so there's probably different pieces to this. But I do have to say that a lot is already happening in this area. I mean, I felt like in the domain of the 4, domains, this area, I was feeling so hopeful, that there really is a lot of work. I felt like some of the educational pieces that I had read were missing. We had good regional center information sometimes, and we had specific to autism, and I felt like dementia Alzheimer's was a little weak. And I feel like at the DOJ post-training, I read through that because you were able to provide that to me, it was not very strong. So that's probably more of a policy. I don't know how you get that updated, but that's a huge thing. And I think some of the even scenarios for training and all in that, we could suggest and add some leadership to the state. So, anything more missing on that? Okay. So the next C2, this is social service provider education. So this is, I know CEO had said early on, keep in mind 2-in-1. So we need to get 2-in-1, the AAA information services, and then I think about all those departments now, like at LA Care and different places, all our community long-term services and support providers. So this would be sort of a whole sort of strategizing how to get folks trained and specifically thinking about this issue. I think we work on it in different ways, touch on it. I guess some of the agencies, right, too? This would probably be, again, Alzheimer's Greater LA, some of the different, like, autism groups as well, so.
Yeah.
Yeah.
I'm just wondering in terms of long-term care, all the residential service providers for the elderly, RCFEs.
Yes.
Should we include like the Department of Social Services here in terms of the ones that do the licensing? I don't really know. I was trying to decide the other day too if we just want to have an ombudsman because they're involved in long-term care, but there's somebody we need to include having to do with all the licensed long-term care facilities for the elderly.
I think I have that in the next one.
Okay. Because they are social service.
I think we learned a lot from Mr. Moody about the importance of this issue, and I think you're right. So then, I think the next one I really emphasized it a lot. Do you think we should invite regional center, and I think we probably need people under social service, and maybe some of the children's groups as well. I think probably for C2 we could do some of the other organizations here.
But just to be clear, when you have on the next one, would you say healthcare provider? The Department of Health Services will be the one to license skilled nursing, but not residential care facilities for the elderly.
Right.
That's not a healthcare. That's community-based, non-medical license.
Okay, so we need to split that out.
So,
I think I tried to put that under there.
facilities for elderly is the Department of Social Services.
Well, I sort of have the continuum of care, and so I have Department of Health Services and Community Care Licensing we coordinate. I guess I was just thinking of all of those facility kind of things.
It just depends on how you word it. When you say health, that's like
That takes you to,
that kind of puts it into this category here instead of
You're right,
just
because
long-term
they're
care.
not supposed to be doing the health, okay. So,
I'm sorry. I'm wondering if under this, we could somehow suggest or we could invite pediatricians. It's a little bit vague, but those who interact with families of children and teens with autism.
Physicians.
the whole physician thing, huh?
Yeah, education, I mean,
Yeah.
it needs to be in doctor's offices when they diagnose somebody, somehow there's pamphlet education
somewhat in
pieces
the
that goes to it. At pediatrician's offices, when they're going to be the one diagnosing, that there's some sort of touch point there for families to get information soon. They're gonna be overwhelmed with that meeting anyways, and so walk out and follow up, but.
So it's a great resource, and I know it's tricky. But
Do you think maybe like some professional organizations, like trying to get the training at the medical associations, Veronica?
So would that actually be training, or would that just be under communication and outreach? Because Mark mentioned something about pamphlets and.
Yeah, I think communication outreach would probably suffice to these medical professionals who have plenty of
The
training.
quickest way to do it
The
is to just
quickest way.
give them
Yeah.
something.
Because my only concern would be then that training then just becomes
Yeah,
so
no.
huge,
Yeah.
that how do you really,
I totally agree. I think something quick, we were talking about just a one sheet, you know, they have those little pamphlets up.
yeah,
We could do Kaiser, we could, I mean.
right.
Contact
Simply the fact
status
that there's so
for all your
many
needs.
hospitals and agencies
Yeah.
involved.
So we'll include all the programs that we're developing here, proactive things that we'll be able to refer directly to register or whatever.
Yeah.
Right.
It's another way to catch people.
So let me clarify then, are we saying move it to, that would be under community awareness here, the social engagement section, as opposed to training?
Yeah, I think so.
And so specific to MDs,
Didn't you want it in both?
Yes,
You
I'm
want
saying,
training
but
and you want them to have the resources that they can provide to families?
I think some things are training and some things are,
yeah,
Right.
well, you know, C3, the strategy for C3 says education and training, healthcare provider education. I mean, so I think we
Right,
should add it maybe as a specific part of that one.
either add as that or parse out and put it in under D.
I think we should add it here and then also add it at the.
right.
Is there a key role in community education when you bring your child to the pediatrician or you take your loved one to the
Yes.
geriatrician or the
Yep.
neurologist and dealing with
And they're doing
dementias?
education, right.
So they should have those.
Correct.
They
Well,
should.
if we as an initiative are providing the resources, I think we can help make it easier. Like you said, Brenda said that actually. But I
I'm
think,
just
you know, I
thinking
can
of
see
the
that
path of
moving.
least resistance in some ways, like
Right.
just, but yes, I mean, ideally, they should be trained and they should have resources to give out. It should be an
Okay, agreeable,
outreach issue.
both spots? Okay.
With OA being under managed care, you know, I was just thinking, trying to do individual pediatricians or with doctors, that's really.
You would do
Wrong.
that.
But you want HealthNet and
Some-
LA Care
Right.
are the two major managed care systems, and you
Right.
work through main people in those areas to get
Seems
that
smart.
out.
Yes.
And so when we get, I think that's part of the planning, you know, is we've got to first make sure that we're working on it, and then I think, getting clear on how we're gonna get the biggest, you know,
Work
impact,
through
where
the
we're gonna
managed
go
care
for
systems,
that.
I think
Well,
that'll
so
be-
I think that's an excellent point. So for LA County, I believe there's 5 managed care associations, Care More, Molina, HealthNet, and I forget the other 2. LA Care, right.
Karen Kaiser.
So maybe if we could target those 5
Yeah.
that are in Los Angeles County, at least at this point, I think that's a good start. Versus then trying to go through, others.
Reach out to community-based organizations though, like if you're gonna do this on the geriatrician side, just call us. We're working with all of them and have been for years. So we can
have to network.
we are a shortcut
Yeah.
to communicating when it comes to this. So I don't want anybody to reinvent a wheel
Right.
that we've already built.
Yes.
So go to your community partners.
Great.
and
So-
see.
Your
I wanted
pamphlets
to
are already in
make
the
a
neurologist's
comment.
office, for example.
Yes, thank you.
You know that they are, the strategies are proven to work. When doing a lead, make sure that you're using something that really works for that segment, rather than just doing something. So this is an evidence base, collaborating with communities, that you have a network already.
Right.
Right, and the wandering issue for the autism community, still, there's a lot of work that needs to be done in getting the information out.
So
That's
maybe
a work in
finding what
progress.
is the best approach in the process, and developing a best practice might be something to consider.
That's great. Yeah, I think with any of these, as you start to, dive into it, there's so much. And that's why all of the partners are on the table here and needed to bring it to life. Okay, so we're on to,
13 minutes to see.
what's that?
13 minutes.
13 minutes, you guys,
You
okay.
guys are doing great.
I think we're getting there. So C3 is, we had talked a little bit about that already, but education and training domain for healthcare providers specifically, thinking about the continuum of care. And then I think this is the one where we really want to focus on the care facilities. And we have Ombudsman has had good input. We didn't name them again under that kind of thinking that we don't have the authority through the county to mandate them to be a part of it, but they would be invited. They would be a key partner here. And then as Kirk was saying, we're not just talking about skilled nursing, we're talking about RCFBs as well. And we've talked about a lot of ways to sort of get people in a more coordinated, where we can get information out to them quicker. But I think this idea of just making sure that they're educated about the issues and say they have a resident that's not clearly.
So my recommendation would be to just put health and residential care provider. Because health, a lot of our CFPs are not health organizations or entities, so they wouldn't self-identify.
Right. Perfect. Love it. Anything else on that one? Okay, we'll move on to C4. And this is the whole area of prevention, working with caregivers and the caregiver training, and there's quite a bit of that going on. The idea of thinking about behavioral management, technology options, respite care options. There's actually, Viviana and I have talked about some of the like FMLA and different policies within workplaces too that some people are not aware of. So there's kind of a whole lot of, ongoing work with caregivers, and we're really lucky in LA County to have a number of providers right now that are working together. I think of USC and Alzheimer's Greater LA and all the AAA.
As a co-lead, I would add Department of Family and Children's Services.
Okay.
And the regional center, or regional centers.
No,
So that would be
less than 5% of everybody we serve is involved with DCFS, so we have 95% of the people that we serve are not involved with DCFS, or, so. Yeah, that's what I'm saying, that what to have, that's a very small segment, I mean, it's still too many kids, but
Yeah. So we invite regional center.
please.
Yes.
Yes.
I'm glad you're wanting to be invited. I was afraid people would say, don't put me down there. We're not doing that. No, we really need that. Okay.
So, yeah.
Okay. Anything more on the,
Do you think that the Department of Mental Health needs to be involved somewhere here?
Mental health.
yeah, because they're doing a lot of that training
Yeah.
actually now.
I think overall, both mental health and homeless services are something that we haven't really focused on in here. I think somehow we need to incorporate that into the report
to
for
leverage
sure.
there.
So definitely, we'll as we revise this document, we'll definitely send it out to you for recommendations.
Okay, and then we'll finally move on to the domain of social engagement.
I'm sorry, I have to
Oh,
back
yes,
up for a second.
sure.
I'm still troubled, under C3 where it says emergency departments through skilled nursing facilities, I really don't understand that statement in parentheses.
They're saying that from the beginning of when the person first comes in, which might be an emergency department, all the way through the long-term care. So this is
Continuing.
Okay, I see what you're saying, over time, not through, okay, the wording tripped
Work
me
on the
up.
wording. Okay.
Maybe two instead
I
of
was just gonna
through?
say two.
Maybe TO instead of through?
Yeah, right.
Good. Good. Yeah, that's good. Okay. Thank you, Carol.
Thanks.
Okay, so the last domain is social engagement. And so this is where, as Kate was saying earlier, that we really need a community awareness campaign. And so I think there's a lot of good work that can be done there around like a proclamation and really being thoughtful in a campaign, probably wanting to bring some kind of an expert to the table to help us with that. But the idea of bringing more awareness to all the work that everybody is doing around this issue, and how everybody in the community needs to be partners in the work that needs to happen. We've talked about LA Metro, and we have invited LA Metro, and we've even gotten confirmation they're coming at times. But there was talk about some campaigns they've done in the past where, for example, I think it was human trafficking. They've done a really wonderful campaign on that. So we really wanted to tap into some of their expertise with our issue, and thinking that we could probably parallel to some of the work they've already done. Again, it'd be sort of cost effective. And also, if we can get it into the metro system, that would be really cool, because you can get out there to a lot of people. Anything more on that one?
Not for D1, but I was thinking if you want another social engagement piece, perhaps a D2. I was thinking along the lines of what the county does for safe surrender. and how that's been quite a project over the last 10 years of safely surrender your babies at various law enforcement agencies. You see bumper stickers everywhere about that. It's actually written into all of our county contracts when we contract out with people. Sometimes they read it, they sign it, oh, we're aware of it, whatever that means. Maybe that's benign, but it's going to kick some eyes, and I would assume that's a pretty low cost threshold to figure out how to integrate that into our contracting. And then perhaps bumper stickers, where maybe that just in general engages society.
Any response to that or thoughts?
Yeah, there's that logo that I think we all recognize now.
Right. And so we can flesh that out more, but let's have a logo. We're all sold on that or not, but start certainly.
It appeared to me one day, and
But again, whatever logo you do with enough exposure, it becomes synonymous.
like that. Okay, so definitely. All right. So we have covered the different strategies. Right. We covered everything. Final steps. What are those? Anything more over there? Okay. So we don't have a lot of time, and I want to leave. I wanted to see if there's any public comment. Is that okay if I move to that?
I think, real quick on the final steps.
Yeah.
I think what we'll do is, before we ask for your guys' input on the actual report itself, I think we'll re-release the other edition of this particular report, which provides the detail to each of the strategies. I think that's going to be critical. I think you will see that many of the pieces that you feel are missing are actually in that particular document. So we could probably get that done in the next day or two, and we'll make sure that is emailed out to everybody.
No brevity here.
Yeah, exactly. But the next meeting will be for January 13th?
December
13th. December 13th, my apologies, yes. So that will be the last meeting, and we all have to be here because that's going to be our voting meeting, correct?
So this timeline has kind of evolved, and so we have, I know Supervisor Hahn can be there December 13th, so we want to come back that day, we want to, fully endorse what we have, right? So again, we'll give you some time to read it up front, so that as you come to that meeting, you can be prepared to officially kind of accept the report. I guess I shouldn't say it that way, but you can come and give your vote. So
when we do release out the report back to you, we'll give you a deadline as to when would be the last opportunity for you to provide us feedback on the report. Okay, so we'll work on that.
Veronica?
Can I also add, just as a reminder for those of you who are here representing your executive staff, those of you especially from county departments, to make sure that you can share this up the chain of command as well, because we would definitely appreciate their feedback, if any, to be shared back to this entity. A lot of times we go back and we forget to do that piece, so if we can do that, that would really be great. Especially those of you who have been identified as co-leads. Definitely appreciate that.
So we have two public comments, I think. So Jason, you wanted to take a moment?
Yeah, absolutely. Thank you for having me. I just wanted to introduce myself, Jason Aroni with CarePoint, and basically we developed a technology item that's a emergency response a watch wearable, if you will. It's bi-directional, so you can actually pull it. If you're a caregiver, you can actually pull where your loved one is, not only for location, but also for different health information such as heart rate and movement and what have you. And there's a whole bunch of other bells and whistles that are involved with this, and we'll be interacting more and you'll see more about our product. Thank you.
And Bruce?
I'm kind of piggybacking on what Mark said earlier about funding. Maybe if we could put something in just general that, because funding I don't think has to come just straight from the county. There's, hospitals have budgets, cities have budgets, regional centers have budgets, nonprofits have budgets, nonprofits can apply for grants. So I could say, here's something I'd like the fire department to work with. So maybe if there's a place I can call up, with you guys, because you're the leads, and say, I have I want to apply for the $60,000 grant for, shoe tags, distributed through the fire department. Does that sound like a good idea? Or maybe the person could say, oh yeah, but it should go through the police, just sort of interaction like that. So maybe just put something in where that budgets can come from many different ways, including gifts and donations in the county.
And I think we have the leveraging piece in there, and I think that is one spot, at least that comes to mind, where we capture some of that. I think it's important. Like there's purchase of service in some programs, that occurs, and so getting, vendors kind of primed so that actually as a care manager in an agency, I could then buy some of the technology because it's an approved vendor for me to spend money on under a purchase of service. So I think there's a lot of opportunities, so I appreciate that. Any other public comments, Kirk?
A couple of times in the working groups, their ideas came up that seemed like it might require a change in legislation at the state level. So this is legislation writing time. I don't know if any of those survive an instant meeting package, but if we have some of those, we want to push them. And this is the time to talk to your assemblyman to get that written up. And again, one of them was maybe in the licensing of RCFEs and nursing homes, they have to report if they have certain types of patients and so on. That was one of the things that was.
The other one is about training, certain number of hours. There's legislation involved in that too, incorporating that into the regular training.
There's some critical incident training mandated, so we'd have to get more specific, but if we wanted it to be more hours or different
Like a
people.
requirement.
It is required, right? I think we already have. There is some optional training though too, that are out there. Yeah, there's so much, isn't there? There's a lot. So I know the fingerprinting for me comes up as another area that needs a lot of work. It just breaks my heart that people are not connected with their loved ones that could be. So, with that, I think we formally close the meeting. Anything you'd like to add? Anybody here? Kate?
Well done. Well done.
You guys want to